Okay, doctor, let's see what our young friend has to say.
Hi,
Hello.
I am Soumya, doing MCA. Most of the females suffering facial hair, and how to solve this facial hair, and what is the side effect of that facial removing?
She has talked about the unwanted hair on the face. Yes.
Okay. Facial hair. First of all, if you have facial hair, what the girl should do is go to a doctor, because it can be a result of a hormonal problem.
Okay.
So the most common thing that causes facial hair nowadays is polycystic ovarian syndrome.
Okay.
And there are also other conditions like adrenal disorders or pituitary disorders, which can cause facial hair. So the underlying cause has to be found out.
Okay.
Because treatment of facial hair nowadays, you can do many things for facial hair. You can do temporary things like waxing or threading or using depilatory creams, but these are all only temporary.
Okay.
If you want a more permanent solution for your facial hair, you have to go to other procedures like electrolysis, and the trend nowadays is laser treatment.
Okay.
But laser treatment is costly. So before going on to any costly treatment, you have to first go and find out if there is any underlying cause, and that should be treated first. Another thing is that you have to ask whether she has any family history.
Okay.
Of, whether
facial
her
hair.
mother or sisters or aunts have facial hair, because many cases may be hereditary.
Okay.
And the side effects regarding laser, other than the cost, of course, if you do it improperly, it can cause pigmentation, facial pigmentation, hyperpigmentation, but usually it's not permanent. It's only transient. It will go off. Otherwise, there are no side effects for laser treatment.
Okay. This laser treatment, does it need only one sitting or?
No, that's also another thing. The minimum, you should do it for 6 months continuously, consecutive 6 months. And sometimes another thing is that laser treatment does not result in hair removal, complete hair removal.
Okay.
It will only cause a reduction in the hair. So it's actually laser removal is actually a misnomer. You should use the term laser hair reduction, because that's what usually happens. And especially in cases with an underlying hormonal problem, this 6 sittings may not be enough. They may have to, continue further on.
Doctor, you said consecutively for 6 months.
Yeah.
In the 6 months, like how often?
Once a month.
Once a month.
Usual treatment
Once a
is
month
once in 4 to 6 weeks.
Okay. After that again, do we have to go to a cosmetologist and check for the hair reduction, or can we stop with that?
After 6 months.
Yeah, after 6 months.
After 6 months, you have to go and check.
Yeah, you have to consult.
And if the hair is coming up again, you may have to continue.
Doctor, we'll go on to the next question.
Hi ma'am.
Hello.
Good afternoon.
Good afternoon.
Ma'am, my name is Surya Supri. I'm an SH final year student and my specialization is electronics and communication. My age is 21. And you know what the girls, the youths, they are, when going in the noon session and all, when they reach home, we can see lots of pimples in our faces and all. So there are lots of medicines available in the market, high colds like that. When we go to doctors, they'll prescribe that. But for most of the students, there will be some bad effects for that.
For the medicines?
Yeah, for the medicines. Yeah. So can you tell any other prescriptions and all, which will not affect our body? Like that.
She has asked about the pimples. Yes, yeah.
She's asked mainly about the treatments how to reduce the side effects.
Okay.
So doctors usually prescribe creams and gels, as well as creams and gels first for pimples, and then when those don't work, they change on to systemic treatment or oral treatment. And creams and gels usually involve a group of chemicals called retinoids. That is usually the standard treatment which is given for pimples, and if not applied properly, it can cause initial irritation. So there are several things which you should remember when applying a retinoid. One is that it should be applied only as a very thin layer. And even when it's applied as a thin layer, it will cause a certain amount of irritation. That's called retinoid dermatitis. But usually if you continue the cream for a few weeks, the dermatitis subsides on its own. But still, if it's very intolerable, another thing you can do is apply the cream as a short contact. That is mainly for 1 or 2 hours, and then wash it off at bedtime, or maybe even on alternate days for 1 or 2 hours.
Is it mainly applied at bedtime, sir?
Yeah, it should be applied only at bedtime.
Okay.
I mean, the retinoids should be applied only at bedtime. And usually the skin gets accustomed to the irritation and the irritation finally subsides. Another thing, whenever you use a retinoid on your face, you have to use a sunscreen in the daytime. Because a retinoid can cause photosensitivity, or that means an increased sensitivity to sunlight. So it's a must that you should use a sunscreen in the daytime also. And there are other antibiotic creams and gels also which can be applied. Benzoyl peroxide, these are also another medicine. This is also another medicine which is given to apply topically for acne. And about the systemic treatment, that depends upon the type of acne. Sometimes if it's just a mild type of acne, the doctor may give a course of antibiotics. But sometimes if it's really severe, then also these retinoids can be given as capsule form. The only side effect of retinoids when given orally is that it should not be given to a female who is liable to become pregnant. So it's usually avoided in married females because it can cause adverse effects to the fetus, that is the baby. And similarly with retinoids, when taken orally also, these also can cause photosensitivity or reaction to the sunlight. So when taking retinoids orally, you should use a sunscreen in the daytime. Another common side effect of retinoids is a dryness or cracking of the lips. So for that you can use just a simple lip balm or Vaseline. Otherwise, there are no side effects. The main thing is about about giving retinoids in childbearing females. It should not be.
These pimples can cause severe scars on the face. So how to overcome that, doctor?
Scarring, that's the major problem with pimples, because pimples, it's a frequent question. Pimples will go off after a few years, so why should we treat pimples? The main thing is to prevent scarring. So for scarring, there are several things which can be done. One thing that commonly youngsters do is break the pimples, squeeze pimples with their fingers.
They have tendency to break
they have a tendency to spend hours in front of the mirror squeezing their pimples. That will invariably result in scarring. So you should never bring your fingers to your face. And there are treatment modalities for scarring. There are several procedures like chemical peels, dermabrasion, microdermabrasion, and resurfacing lasers like erbium glass or erbium YAG or carbon dioxide lasers. These are all treatment modalities. And you can do simple surgical treatments also. There are different types of surgical procedures. Derma roller treatment, that's another thing which can be done for. There are several treatment options for acne scars.
So it all has to be decided by
you have to go and see a qualified dermatologist and decide. And it takes time also. It takes a course of several months.